Hello, my name is Jesse Griffin, and today I'd like to talk to you about prostate cancer. Prostate cancer is the second most common cancer among American men, and the biggest risk is simply being a man. Every year, 1 in 6 men will be diagnosed with prostate cancer, compared to the 1 in 8 women that will be diagnosed with breast cancer. Does this sound familiar? Well, probably not. Did you know that September is National Prostate Cancer Awareness Month? In 2010, over 217,000 men were diagnosed with prostate cancer, compared to the over 207,000 women and over 1,900 men that were diagnosed with breast cancer. While any form of cancer can be deadly if left untreated, only prostate cancer affects men. The prostate surrounds the urethra between the base of the bladder and the muscular sheet that makes up the floor of the pelvic cavity. The prostate is nestled at the bottom of this cavity, surrounded by blood vessels, nerves, and connective tissue. All male animals have some type of prostate. It is fundamental to our evolution. The primary function of the prostate is to produce semen. Semen consists of proteins and other chemicals that nourish the sperm and are critical to male fertility. The portion of the semen made in the prostate helps preserve and transport sperm that are formed in the testicles and stored in the adjacent epididymis. Without the prostate, reproduction through sexual intercourse would be impossible. Here the prostate fluid joins the mixture of semen from the vas and seminal vesicles. The fluid is expelled through the urethra by powerful muscle contractions. An infant male's prostate gland is no larger than a pea. The gland develops to its adult size from exposure to the male hormone testosterone. The prostate is distinctive from the bladder, urethra, and urethral sphincters. Although it is in direct contact with these other structures, the prostate measures only about 5 centimeters wide at its base and slightly less than its vertical diameter. It weighs about 20 grams. The prostate has 2 sides, or lobes. The entire structure is covered by a thin capsule. The gland is divided into 3 zones: the preferential, central, and transition zones. The prostate is made up of 2 types of tissue, the epithelial and connective. Both types of tissue are unique to the prostate, but only the epithelial tissue produces the prostate-specific antigen detected in the PSA test. These glandular cells secrete chemicals that make up the prostate's contribution to seminal fluid in a network of hundreds of mini glands connected by small ducts to the urethra. It is these glandular cells that become cancerous and produce prostate cancer. In North America, physicians recommend that men should have annual screenings and prostate examinations, but many men do not. Some are unaware of the risk of having prostate cancer. As men increase with age, their risk increases exponentially. A 97% increase risk occur in men 50 years of age or older. Men with a single first-degree relative, father, brother, or son, with a history of prostate cancer are twice as likely to develop the disease. Screening by prostate-specific antigen, or PSA blood test, is far from perfect, but it does save lives. Race also plays an important role in cancer traits. If you are of African or Hispanic descent, then you are at a 5 to 10% higher risk of developing this horrible disease. But this and other forms of cancer can be somewhat controlled and even possibly prevented by healthy diets, no tobacco use, sex with only one partner, and using sun radiation protection. There are just a few of the behaviors that can be used to change and modify the decrease of risk. More than 220,000 men are affected by prostate cancer every year, and that number is increasing. In 2010 alone, breast cancer research received over $891 million, compared to the $399 million received for prostate cancer research. According to the American Cancer Society, breast cancer received twice as number of grants as do prostate cancer. This is due in part to the vast variety of media coverage and awarenesses, such as pink ribbons, Breast Cancer Awareness Month, outspoken men and women and celebrities, and to that, the aid of the National Football League. In 2014, there are approximately 233,000 predicted cases of prostate cancer. More research must be done to develop better treatment and detection to make prostate cancer curable. Even through research, prostate cancer can be prevented, but there is no cure. In conclusion, we should be aware of the dangers and the risk of prostate cancer. It is unrelenting and just as a viable killer as breast cancer. More awareness and research must be done to help rid the world of this killer of only men. Thank you.